Hi, I'm Steve Selig, founder of Fit Test, and the title of this talk is So You Want to Test or Prescribe Exercise at 80% of Heart Rate Max? This is what is often wrong with this approach, and why I much prefer to use percentage of heart rate range instead. And so I'm going to go over a few conditions that I'm sure you will come across, because I come across them very frequently, where using the percentage of heart rate max is totally inappropriate and at times even unsafe. So when I thought about this concept of percent heart rate max, which so many people use both for testing and prescribing exercise, I decided to sit down with a blank sheet of paper and just come up with a list of conditions, and just cardiac conditions, for which using percent of heart rate max would not only be not valid, but could even be unsafe. And the first one, an obvious one, and I'm sure you know this, beta blockers, where beta blockers, because of the blocking of the sympathetic nervous system and adrenaline into the heart itself, it slows heart rate both at rest and in all levels of exercise right up to peak exercise. So it immediately invalidates percentage of heart rate max by some 30 to 40 beats per minute. And if you decide to use this in either testing or prescribing, you'll almost certainly over-exercise your client, and that could be unsafe in certain clients. Calcium channel blockers, similar for a different mechanism and also a different level. They don't drop heart rate as much as beta blockers, but certainly drop heart rate. And one of the mechanisms there is lengthening out the length of the action potentials in the heart, which then makes the heart actually slow down in heart rate. Funny channel blockers, which block the sodium potassium inward current and are effectively membrane stabilizers, targeted at the main pacemaker tissues in the heart, the sinoatrial node. And the main drug that I come across here is ivabradine, which is getting more commonly prescribed for people by cardiologists when they want to slow down the heart rate in their clients. And clearly, again, you can't use percent heart rate max. People with a sick sinus node, that is, they tend to have lowish heart rates at rest, but not through fitness, but through disease, and definitely have a very flat heart rate response to exercise, where the heart rate doesn't go up nearly as steeply as a normal healthy person during exercise. And so clearly this invalidates percent heart rate max. The sinoatrial node can also undergo pauses or blocks. I won't go over the mechanisms here, but again, this will interfere with heart rates both at rest and in exercise. AV nodal blocks, this is the pacemaker tissue between the upper chambers, the atria, and the lower chambers, the ventricles. So in second degree and third degree of this form of heart block, we can get block of some of the action potentials or the electrical stimulus through into the ventricles, and in so doing usually slows down ventricular rate or heart rate. We can get on wandering atrial pacemaker, which I won't go into here. Ectopic beats, atrial ectopics, ventricular ectopics, and junctional ectopics coming from the atrioventricular node. These will interfere with heart rates. Obviously, someone with a permanent pacemaker, PPM, these are programmed not to go to age-predicted heart rate max. Almost, I've never seen them being programmed all the way up to heart rate max, but they may do, but I certainly don't come across that in my practice. People with ventricular tachycardias, or supraventricular ventricular tachy and junctional tachycardia. These are fast heart rates that go way above the age-predicted heart rate max. Then we can get into atrial fibrillation and atrial flutter with variable AV nodal conduction. These arrhythmias and conduction defects, arrhythmias. These will sometimes have heart rates lower than predicted and sometimes have heart rates higher than predicted. And remember that medications come in over the top of these drugs, and that will further affect the actual heart rates that you're recording. Barrier reflex failure, I've seen this many times in my practice. Examples would be neck surgery that interfere with the barrier reflexes post-surgery, and also trauma and motor vehicle accidents. I've seen it as well. Vagal tone and symptomatic braddies. These are people who have very low heart rates due to excess vagal tone, which reduces their heart rate at rest and in exercise. Athlete's heart, I'm sure you're aware of, where some aerobic athletes actually have low exercise heart rates, well below their predicted heart rate max. And just to finish, the list that I've produced here on is just for cardiac. And so after compiling this list, I also thought that there are many other organs that interfere with percent heart rate max as well, being thyroid, kidneys, hypothalamic, pituitary, adrenal axis, the adrenals themselves, and even muscle. So just coming to a case study now of how I deal with this issue. And this is a 66-year-old female with coronary artery disease and chest pain and high blood pressure. Her predicted heart rate peak was 159, and her actual heart rate peak was 117, which was 73%. So if we were trying to get to 80% of predicted heart rate max, we would have got way past her maximal ability to do aerobic exercise. Clearly unsafe. Her medications, beta blocker, atenolol, and ditilazam hydrochloride or vasocartil, which is a calcium channel blocker and also an anti-anginal. And these drugs primarily have caused this heart rate peak to be well under 159. So, and then these are the non-heart rate modulating medications I just listed over here. Cartia is an antiplatelet. Clopidogrel is another antiplatelet. Perindopril, Covercel is an angiotensin converting enzyme inhibitor. Rosuvastatin or Crestor is to lower cholesterol. And isosorbide mononitrate or Monodur is a really useful drug for people with chest pain because it is a long-acting coronary vasodilator. So it's a long-acting anti-anginal, which is really good. And then she was on an antidepressant as well. So how did I deal with this? Well, I ended up using the method of percent heart rate range using my app FitTest. And you can see here, I did a program here just based on percent heart rate range, going 60, 70, 80, stepping it up to 90% here of heart rate range. And that actual heart rate of 90% heart rate range would be a heart rate somewhere around 105, 110, but nowhere near 117 and certainly nowhere near 159. And then stepped it up and down a few times with 2-minute active recoveries in between the big step ups, and then stepped it down to recovery. And you'll notice that these heart rate ranges then are reasonably similar in this instance to the percent VO2 peaks that are shown next to it. So that's how I use my own app to deal with clients very successfully with this sort of presentation. You can contact me at info@myfittest.com.au and have a great day. Bye for now.